Hi, everybody. My name is Hannah Davidson, and I will be presenting my ethical dilemma on mandated reporting. So, the summary of my client, who I'm going to be talking about today, is my client, JJ Walker. She's a 50-year-old woman who struggles with high levels of self harm and suicidal ideation. JJ is a heterosexual white female who struggles with general anxiety disorder and high levels of depression. JJ is often sharing her thoughts about her self-harm and her plan or her attempt to do so about 50% of the time during our sessions. JJ often shares these thoughts, and it is sometimes overwhelming to determine whether she is sharing these thoughts for intention or if they are valid with her actions. I'm going to be talking about when do we report, how do we know when to report these things, and some resources that we can rely on in determining whether to report and who to report them to. I also am going to be touching on the frequency of reporting. So, do we report every mention of these actions and how to follow through them? Ethical relativism. As mentioned in the reading, Guidelines for Ethical Decision Making, in my client's case, I think the ethical relativism framework addresses this ethical dilemma the best due to the fact that this theory holds morality and it is relative to the norms of her own culture. I think today there is a huge spike in suicidal ideation and in self-harm, and I believe that that is something that is present in today's culture due to mass media that's going on and just to the pandemic and things like that. While actions of self-harm and suicidal thoughts can be seen as being right or wrong depending on the moral norms that we live in, we are taught to see something, say something. I think this is accurate in our professional and our personal lives, while this action may be wrong in other societies or cultures. This framework applies to this ethical dilemma because we need to put the safety of our clients first, and sometimes can get overwhelming in knowing what is professional to report as therapists. So, ethical principles. The two ethical principles that I'm having conflict that are causing this ethical dilemma are maintaining my client's self-determination, autonomy, and freedom, and trying to support her in these things. Also keeping a strong rapport with the client and having the client trust me. And the thing that I'm facing is appropriate and professional mandating reporting. Because JJ is feeling these thoughts and she shares them openly with me, she does not always see them with intent or an action to do so. But by me wanting to maintain a trustful relationship with my client, I need to know when to report these thoughts and actions, but I also want to maintain my client's self-determination without breaking, bonding or trust. So that's kind of where the ethical dilemma that I'm facing is how that these thoughts are often said. Should I report them every time? If I do so, is it breaking the bond and the professional rapport? For environmental context, I did an eco map of how we look at her environmental context and relate it to mandated reporting. So for JJ, the three main factors that she deals with on a daily basis is her family. She's a provider of a lot of children and her niece and nephews. She does have several mental health struggles, and she has been struggling with mental health for a very long time in her life. She also has been misdiagnosed several times in her past. And then just other environmental factors in general. So like her social circle and how she relays this information to. There are a few issues that raise concern while addressing the ethical dilemma on mandated reporting. The client often shares that she has a family she would not want to leave behind or will withdraw from, claims she has said when I inform her about her thoughts, actions, and the pain of her thoughts that she's mentioned to me. I kind of try to put in perspective the thoughts that she is speaking into actions and what her life would look like that she left behind. Cultural consideration. I think my client has a lot of mom guilt. She's very stressed out and feels like she has to be okay for everybody else. And in terms that makes her feel the way that she does. I think that there's a lot of mental health stigmas, so that, in America, if you're not perfect, then you're not successful. And I think that kind of gets to her, and that also ties in with being a mom. I also think sometimes she is ashamed or embarrassed in asking for help, and that is why she participates in high levels of self harm, because it's more of like a coping mechanism or an outlet for her. Applicable laws, I think that go hand in hand with mandated reporting is like self neglect. So we have heard about this in cases for elderly people, and just in general, like poor hygiene and not taking care of oneself. So self neglect, the crisis hotline, as professionals, we are by law mandated to report high levels of suicide when the client has plan or intent to do so. And then just overall unhealthy living circumstances for the client. Policies that contribute positively to this ethical dilemma are laws that protect the overall well-being of clients who struggle with these issues pertaining to these topics. Personal values. I think my client's personal values for herself, and how it also ties into my own personal values, is safety and well-being, number one first for the client. Maintaining professional conduct and providing resources and education for my client. I have managed to move forward with the ethical dilemma in my decision-making process by maintaining the mindset that the client's safety always will come first. By keeping this mindset, it helps me determine what to report and what not to report. The hardest part for me in the situation is determining the level of severity with my client. With her specifically, because she does not like to use self-harm as a way, because she does like to use self-harm as a way of getting attention. We do a risk assessment in our weekly sessions and work out a care plan to talk about next steps in her safety, as well as to ensure her safety. Resolution. So a resolution to this dilemma that I have been using with my client so far is having a strong care plan with my client, guided steps and actions of who to reach out to, and being able to answer her questions, and then significant of what is mentioned to me as a professional. So determining what to take away to report and not. This dilemma is something that I still am challenged with on a daily basis in my overall field. I don't want to be overly reporting what is happening with my client to backpedal in report building. I need my client to be able to trust me, but I have approached the situation by informing my client about putting her safety first and how we can create a care plan for her when she's feeling thoughts of suicide. We have reached the state in our therapy sessions to, during the session, report her levels of self-harm as well as her levels of suicidal ideation for the day. And then we talk about the means to do so and the likelihood of this action, basically her plan of intent. This way, I am able to assess what needs to be reported. I am also honest with my client about what she shares with me and my professional responsibility that I need to take if things are shared with me, and how I will have to report them to higher resources to better support her. In this case, for example, I would be reporting to the mobile crisis center or the crisis hotline. There's also a resource to report to health and welfare for adult protection pertaining to welfare checks. Theoretical framework. Because I only see my client for weekly sessions, I cannot control what actions she partakes in after she leaves. My responsibility to her once she leaves for the day is done within our session until the next time I'm able to check in with her for our weekly sessions. Some social environment, human behavior theory, theoretical framework is what I think best fits this ethical dilemma. The client has a lack of family and social supports. Her care team is her largest social support. The client does function at a low cognitive ability due to her past injuries and also having mental health for a majority of her lifetime. I also believe that the client lacks understanding of the actions her thoughts carry. So when she just freely states that she's feeling suicidal, I evaluate the intervention and outcome of this dilemma with my client by providing a step-by-step care plan with her. I inform the client about steps she can take when she is feeling levels of suicidal ideation or levels of self-harm, and have done proper intervention of de-escalating mechanisms for a lasting outcome with my client. These informed tools help build on recommendation and rapport with my client. Ethical and professional behavior as a social worker. This ethical dilemma has influenced my own understanding of ethical and professional behavior as a social work professional, relating to me personally having to be professional and place my own personal opinions to the side. I think it is also important to not discourage my client away from her own self-determination, learning how to respect their decisions and how to respond based on what they're needing from me. So I think balancing that fine line of being able to support my client professionally without having implicit biases, as well as being able to provide for her in further resources that she needs from me. Thank you.